right now, I want to bring on our first guest for today, Rey Colon with MyTelemedicine.com. Rey, good morning.
Hey, good morning. How you doing, sir?
We're doing great. Great to have you with us. Appreciate you spending time with us today.
Great to be on.
How's it in Dallas, Texas today?
Oh man, lucky for us, the rain has stopped, and we got some beautiful sunshine out. So I'm really excited.
Yeah, well, we're your sister city, so we're getting the rain you had yesterday over here in Atlanta. Well, Rey, listen, a lot happening in telehealth, and you've got a pretty deep background in this. Before we kind of kick off, really talking about more, give our audience and our listeners a real backgrounder on MyTelemedicine.com and your background too, and your vision for what you're doing now with MyTelemedicine.com.
Excellent. Well, my background originally started out in the digital healthcare space, in the digital marketing space, and back in 2008, we a couple of buddies of mine, and we saw what was going on in the healthcare arena. We saw technology being kind of the forefront and something that was exciting and coming up over the coming years, and we started a company called Access MyMD. After securing some funding, we rebranded as Ameridoc, and we moved operations to wonderful state of Texas. And Ameridoc, after nearly 3 or 4 years, Ameridoc was acquired by a larger group in the space. And I just saw some exciting opportunities still going on within the telemedicine market. Even though for guys in the healthcare space, providers and employers, it's been around and it is a buzzword that's been going around for, the past 3 to 4 years. To the consumer end, it's still very young. It's still in its embryonic stage. I believe that digital healthcare across the board is growing rapidly. And when the thought process of bringing a new company into the market was birthed, we knew that we didn't just want to be another Me Too that was out there. So what we focused on here at MyTelemedicine was really our technology. That was the core. Before our first line of code was written by our partner and Chief Technology Officer, Jesse Roach, before anything was done on that end, we knew that there was a play not only on the service model to bring this to employers and affinity groups out there, but we knew that providers were going to adopt it. It was just a matter of time before state regulatory laws made it more friendly, and we wanted to be in that space leveraging our technology. So we went out after about a little over a year of development. We launched with our MVP, and we're growing rapidly. So we have a service model where we have physicians all over the U.S., in every state, and minus Arkansas due to regulations in Arkansas, we're able to service consumers by providing them access to a physician 24 hours a day, 7 days a week. And these doctors are able to provide them advice and recommendations for common acute illnesses. In addition, they're also able to diagnose them for these common acute illnesses and call in a prescription to their local pharmacy. So that's really the service model side of it. But what we've done is as we start to see the market grow and digital healthcare, especially with wellness in the workplace, grow, we saw an opportunity of creating our platform to where it can be fully integratable. So we built a full open API around our technology that allows any third-party company, whether they're a wellness platform, an electronic medical record, or just a savvy entrepreneur that wants to build a mobile app, they can integrate into our technology, their look, their feel, desktop, mobile, and now they're able to offer telemedicine, however, utilizing the MyTelemedicine engine and physician network on the back end. So it's been an exciting run, and we're really excited to keep on moving forward and grow with the space.
So can you embrace, do you work with brokers too, Rey?
Absolutely, yes. Brokers are a really key part of our business.
Okay.
At the end of the day, with employers, really with anybody, it's about relationship, and we might go to a large organization and they might love telemedicine, but at the end of the day, they have a broker. That's their voice. That's the person that they trust. So we build relationships with brokers all over the U.S., TPAs, agents, agencies, and even individuals, and they're now able to take our product under their own brand if they like, or promote MyTelemedicine and now offer it to their clients.
So you can either do a private label if it's a large enough broker, you can do a private label model for them, or they can market your MyTelemedicine.com, either version, right? That's what you're communicating.
Correct. Yes, absolutely. And one of the things when we started building, we really took the feedback from all the relationships that I had in the space. So a lot of our resellers and partners that we worked with, they said, man, the only thing is we're losing deals because when we go out and promote, hey, we're reselling XYZ company, they now just go direct. So we gave them a solution that allows them to white brand it, white label it, all under their own look, feel. MyTelemedicine's never in the mix, and now they're able to go out and sell their product using our engine. So it's been a great, exciting tool, definitely a differentiator and a disruptor in the space, and we're excited to see where it goes.
A lot of the research, Ray, out there really talks about the tremendous adoption and uptick from employers. And, I look at that and have my perspective, but I'd love to get yours on the embracing of employers to telehealth, and where do you see that trend continuing?
Absolutely. The market is growing rapidly across the board, but employers every day, especially large self-funded groups, they are looking for any opportunity to really move the needle in claims costs and savings. Telemedicine is a true tool that allows their members to avoid going to costly emergency rooms or urgent care clinics, or even taking time off from work to now have to go to a doctor because they are or their children are running a high fever, where telemedicine actually gives them access to this, and there's a significant savings. Shroom recently did a study and said that over 68% of self-funded groups plan on adopting telemedicine between 2016 and 2017. So the market's really prime. I think what's happened is that over the years, we've really built a solid business case. At first, when we were doing this back in 2009, 2010, there was a lot of confusion. Could it be done? How's the savings? Is it even legal? There was all these concerns, but over the year, as the industry has matured, employers now see this as a true value. The key thing is engagement. It's really creating engagement and educating the market, whether it's the employer or the consumer, on the value of this benefit, on how it complements their current benefits that they might have with their company, and educating them on how and when to use it. What we've seen is when a member does use it, they're hooked. It's the aha moment for them. Wow, I was able to pick up the phone, connect with a doctor, and, my child is feeling better. And then they're a believer and they constantly use. So our focus, leveraging technology, is to create engagement tools that will educate the consumer and educate the employer on how to reach out to their population on the value of telemedicine, hence all driving savings.
Yep. Ron, you got a question for Ray?
Yeah, Ray, this is Ron Bachman. On your website, there is a great quote of information from the Wellness Councils of America that says, research shows that 70% of doctors' office visits are unnecessary, and over a third of all minor medical conditions can be treated without a trip to the doctor's office at all. Some have said that the future doctor's office is actually going to be your living room. How does your services help support that? And maybe you can describe briefly the different types of services, from electronic medical records, a lab test, to wellness testing, advocacy, phone consultations. I think a lot of people think that everything's just about phone or video consultations, but you seem to have a broader package.
Correct. Yes. I mean, at the end of the day, the first thing is telemedicine's not here to replace your primary care physician. We're here to give you access when you need it conveniently and affordably, especially when it's after hours. However, there are more than just picking up the phone and talking to a doctor. Our members have the ability for continuity of care after a consultation has been done, they can log into their personal health portal. They're able to not only manage their personal health records and share these health records with their primary care physician, but if they have a question regarding a consultation that they've had previously with a physician, and let's say it's a week later and they just had a question, hey, I've noticed this, they can just send a message back to that physician, and now they're able to have this ongoing interaction regarding previous consultations. In addition, as the market continues to grow, there are many opportunities to leverage other solutions. One of the things that we've recently done is we formed a relationship with a wearable integrator, and every wearable device that's out there, whether it's a Fitbit, but more importantly, your healthcare-related medical devices that are Bluetooth and Wi-Fi enabled, our system has the capability of pulling in real-time data on those consumers and then, in turn, creating actionable outcomes. So what we want to do is create a package that really brings value, not only the aspect of, hey, I need to talk to a doctor, but when you think of advocacy, we partnered with a great company, and they have a national advocacy network. So there are times when a consumer just has a question, and they're not sure if this is a medical question. Maybe they need a referral, and they're not sure where to go. And most consumers kind of leverage Google, and they go online, and they read all this stuff. So our solution, when you incorporate other aspects of healthcare, like even an advocacy program coupled with telemedicine, this consumer now has access to physicians for that real-time care access, but at the same time has a tool to educate them and kind of be a liaison to navigate through the cumbersome healthcare system that we have today. So it's really important to add added value solutions to complement telemedicine and bring out a well-rounded healthcare solution to employers and their employees.
Hey, Ray, this is Doug. When looking at your model for employers, if I'm an employer with 5,000 employees, what's your business model for me and then my employees? Are the employees paying a per-use fee? Are the employers paying any per monthly fee? Per employee per month fee? How does that work, please?
Very good question, Doug. So really, our goal is focused around and tailored to the employer. So the first thing, whenever an employer reaches out to us, we really want to sit down and get in the think tank, get in the whiteboard and kind of say, what's your goals? What's your objectives? And based on those objectives, we can create a plan because we are the provider. It's our physician network. It's our technology. It's our 24/7 call center. So we create a customized program for them. Now, in most cases, most of the consumers, most of the employers, because telemedicine is still so young to the consumer's eyes, they want to incentivize the member to try it. So what we typically do is most of the programs are no cost to the employee. The employer pays a per member per month fee to give their employees access to the service and to our physicians. And then in return, we educate those members as to how to use it and when to use it, utilizing digital and traditional marketing methods, and now their members have it. Now, there are cases when, based on a group's budget, that a group says, hey, you know what, we want to give access, but the member can pay a consultation fee. And that consultation fee typically is right around $35. And then also we have like a hybrid model. So, maybe a group says, hey, we want to have a consult fee of only $10. So, again, being the provider, the back engine, and the network, we can really create a program that's tailored specifically to the group's goals and objectives when they come aboard.
So coming upstream to a broker network that you embrace. So can a broker enhance their revenue model with your solution? Are there
absolutely? I mean, it's a great. Go ahead.
No, are there commissions here for the broker?
Absolutely. So we have two kind of models. We have a traditional broker model where they take, the MyTelemedicine brand. They're taking our product portfolio and they're promoting it to their clients. And then, of course, there's a commission avenue for them. And this really helps them subsidize with everything going on with the Affordable Care Act. Brokers are really looking for additional ways to drive revenue, with the average commission on healthcare insurance being down to 6 or 7%. Most of these insurance companies are now selling directly to the consumer and not giving exclusivity to their brokers. So we do have a broker program where they do get a commission. And then for larger groups that do more volume, we have a reseller program where we can provide them with a wholesale, you can essentially say a wholesale rate, a net rate, and then they can go out and they can mark it up and then take it to their clients as they see appropriate and based on their needs. So we do have and provide really good tools for those brokers and resellers, so that way they're also educated as to the value of it, and then they can relay that same message to their clients.
Okay, we got about a minute or two, Ray, to go. So I want to ask you about one other market, and then I want to allow you an opportunity to kind of, leave our audience with a few takeaways. And you were with us, and I know you came, some of your team, and attended in Dallas. With your private label model, you're a pretty good fit for some of these emerging exchanges. You see that as a good distribution avenue for you?
Absolutely. The exchanges are always looking for ways to, especially with all the excitement around the exchange system. When we went to the conference, there were multiple providers there. So what's the differentiator? And we are now embedding our solutions into them. We're coupling them with the health plans. So it's definitely a market that we've been researching, talking to a lot of exchanges now, and most definitely we see telemedicine being a great complement and fit to these exchanges and giving them just another avenue of a benefit that's really going to bring value coupled with their insurance package that they select.
Yeah, and that fits well with your I could see you really helping some of the exchanges too with your digital experience and background, because that's where they're focused too. And I think that you're integrating that piece, but then how you really help them market it and make it happen. Well, we got about a minute to go, and I'd like to. It's been great having you on the program. It's an exciting topic. It's a growing topic, as you said, growing trend. It has its place in this market, providing better care and access to care. Leave our audience with a few takeaways, if you would, Ray.
Again, our goal here is we're a young company, and one of the things that we've really seen in this space is at the end of the day, it's about the end user, the employer, and the market, and the employees. And what we really want to do is bring a true value service. We don't want to commoditize it. We don't want to discount its value. If promoted right, it can truly bring value. So what I want to leave with is just that when a group or an employer is out there researching, really factor in the costs associated with it, because it's about engagement, and the more engagement utilization you have, the more savings you're going to have. In addition, we're really focused on the service side. Members can pick up the phone, talk to a care coordinator 24 hours a day, ask questions. They can just update their medical records right online. If anybody wants to learn more about MyTelemedicine or to speak with us here, or even myself, they can always visit www.mytelemedicine.com, or they can just give us a call at 1-800-611-5601, and a member of our team would be gladly here to answer any of their questions.
Thank you. Thank you very much, Ray, and I appreciate you joining us and spending time with us. Have a great weekend there in the Dallas area, and we'll talk again soon.
Great, Doug. Look forward to it.